Hi all, I am Dr. Pradesh. Today's our topic is about acute stroke, that is brain stroke. So in this video we will be seeing how to recognize an acute stroke and what all are the treatment options available. So first of all, what is the relevance of this topic? We know when a patient develops acute stroke, millions of neurons will be dying in each minute. So it is very important to recognize the stroke immediately and to start the treatment as early as possible. So first is about how to recognize symptoms of stroke. We know in developed nations there are some toll-free numbers. When a patient develops symptoms of stroke, they can contact in a toll-free number, and one health worker will be coming and screening the patient for evidence of stroke. And if he is found to have evidence of stroke, then he will be taken up to higher centers and proper treatment will be ensured. But unfortunately, in developing countries like India, we don't have such toll-free number. In this regard, all of us should be aware of the what all are the symptoms of stroke. So, when a patient develops stroke, he will develop acute symptoms. Suddenly, he will have some neurological symptoms. What all it can be, we will see. It is known by the acronym B FAST. So each letter denotes each symptoms. First is B, that denotes balance problems, sudden onset of balance problem. Second is E, that means sudden onset of visual problems. Then third thing is F, that is facial deviation or drooping of face. Then A means arm drooping, weakness of arms or one side of the body, which all of us will may be knowing. In acute stroke, we will have hemiplegia, that arm and leg weakness. Then S denotes speech problems, and T denotes uh, importance of time, and also we have to note the time at which the symptoms started. So these are all the major symptoms of uh, acute stroke. So once we suspect that we developed symptoms of stroke, we have to immediately reach the hospital where an expert neurologist service is available, preferably in a stroke unit. After reaching there, the scan imagings will be taken like CT scan or MRI scan, and they will see whether we have got a intracranial bleeding or it is an ischemic stroke. Intracranial bleeding has got limited treatment options. We will be mainly discussing about ischemic stroke. So what are all the treatment options available for ischemic stroke? So there is a procedure called intravascular thrombolysis. That is, in simple language, if we say, one injection will be taken which will dissolve the clot formed inside the intracranial vessels, by which this stroke is uh, caused. And when this clot is dissolved, this blood circulation into the brain will be re-established. So that procedure is known as thrombolysis. And what is the second treatment option available? If the stroke is very large, if very big clot is formed, then there is a procedure called mechanical thrombectomy. So that mechanical thrombectomy can be done preferably within 6 hours, and on case to case basis it can be done even up to 24 hours or even later if the intervention neurologist consider. So by that procedure, that clot can be retrieved and blood circulation can be re-established. So this procedures thrombolysis for 4.5 hours and this mechanical thrombectomy till 6 hours or 24 hours or even later. These are all the major treatment options available. So this shows the importance of starting the treatment as early as possible, because after these time points are over, there are hardly any treatment options available. So whatever else that can be done are tablets which will prevent further stroke. That means secondary prevention only, and also some rehabilitative measures by which this weakness which is already established, and we will be helping the patient to regain that power. So that again shows the importance of time. So this video is done to make the people aware of this disease and the treatment options that are available. So help us to spread the message to maximum people. See you in next video. Bye.